Thank you for subscribing to this channel. This is a Reading Part C practice video.
According to the paragraph, the primary purpose of obtaining a patient's consent for the review is option B, to enable the accredited pharmacist to access relevant information. Here's the explanation in simple English. The paragraph mentions that the consumer's consent is obtained by the GP, general practitioner, when initiating the home medicines review, HMR, referral. This consent allows the consumer's information to be given to the accredited pharmacist who will conduct the review. The purpose of obtaining the patient's consent is to allow the pharmacist to access the relevant information necessary for conducting the review. This means that the patient agrees to share their information with the pharmacist so that they can evaluate the medications and provide appropriate recommendations. Now let's analyze the other options and explain why they are incorrect. A. To give patients the liberty to participate or withdraw from the service. While the paragraph states that the consumer has the right to withdraw from the service at any time, this is not the primary purpose of obtaining their consent. The primary purpose, as mentioned earlier, is to enable the pharmacist to access relevant information. C. To ensure that the information is safeguarded with security measures. While the paragraph mentions the need to respect the consumer's right to privacy and confidentiality and maintain confidentiality through secure files and encrypted electronic messaging, this is not the primary purpose of obtaining the patient's consent. The primary purpose is to allow the pharmacist to access the relevant information, as explained in option B. In summary, option B is correct because it aligns with the paragraph's statement about obtaining the patient's consent to enable the accredited pharmacist to access the relevant information for the review. Options A and C are incorrect because they do not reflect the primary purpose stated in the paragraph.
Let's look at the next question.
According to the paragraph, the guideline tries to regulate the number of hours of work permissible. Here's the explanation in simple English. The paragraph explains that the working time regulations state that workers cannot be forced to work for more than 48 hours on average. It also mentions specific limits for young workers and junior doctors. The regulations cover various aspects related to working hours, including working at night, health assessments for night workers, time off, rest breaks at work, and paid annual leave. These regulations aim to regulate and limit the number of hours individuals can work. Now let's analyze the other options and explain why they are incorrect. B. Uneven working hours for different professions. The paragraph does not mention anything about uneven working hours for different professions. It primarily focuses on the number of hours permissible and the regulations applicable to workers in general and junior doctors specifically. Therefore, option B is incorrect. C. Intensity of the work done in stipulated time. The paragraph does not mention anything about regulating the intensity of work done within a stipulated time. It primarily discusses the number of hours individuals can work and the various regulations related to working time, breaks, and leave. Therefore, option C is incorrect. In summary, option A is correct because it aligns with the paragraph's statement about the working time regulations aiming to regulate the number of hours of work permissible. Options B and C are incorrect because they are not mentioned in the paragraph and do not reflect the purpose of the guideline.
Let's look at the next question.
According to the paragraph, the note emphasizes the significance of the difference by indicating the contrasting purposes. Here's the explanation in simple English. The paragraph discusses the concepts of aggregated and disaggregated data. It explains that aggregated data are combined from multiple sources and summarized for a specific purpose, such as reporting or statistical analysis. On the other hand, disaggregated data are separated again according to a specific variable, allowing for more detailed analysis and informing decision-making and planning. Now let's analyze the other options and explain why they are incorrect. B. Highlighting the informational value. The paragraph does not explicitly mention highlighting the informational value as the purpose of the note. It mainly focuses on the difference between aggregated and disaggregated data and their respective uses. Therefore, option B is incorrect. C. Exhibiting the distinction in outcome. While the paragraph mentions the distinction between aggregated and disaggregated data, it does not specifically highlight the distinction in outcome. It primarily focuses on their purposes and how they can be used to reach targeted groups more effectively. Therefore, option C is incorrect. In summary, option A is correct because it aligns with the paragraph statement about the note emphasizing the significance of the difference between aggregated and disaggregated data by indicating their contrasting purposes. Options B and C are incorrect because they are not explicitly mentioned in the paragraph and do not reflect the purpose of the note.
Let's look at the next question.
According to the paragraph, the standard procedure for health surveillance must include formulation of tests for close scrutiny. Here's the revised explanation in simple English. The paragraph explains that health surveillance is necessary for employees exposed to hazardous substances. The substances can be absorbed into the body through various routes, and their metabolites can harm organs. Health surveillance involves conducting tests for close scrutiny and monitoring. These tests can range from simple skin inspections to more complex examinations such as lung function tests and urine, breath, or blood analysis. The paragraph states that the appropriate type of surveillance depends on the availability of tests. In the case of tributyl tin oxide, a timber preservation treatment, it was withdrawn because an appropriate test for its metabolism in the body did not exist. Now let's analyze the other options and explain why they are incorrect. A. Tests that require biological monitoring. While the paragraph mentions biological monitoring as a component of health surveillance, it does not explicitly state that this is the standard procedure. It focuses more on the formulation of tests and their availability. Therefore, option A is incorrect. C. Constant testing to check for irregularities. The paragraph does not mention constant testing or checking for irregularities as the standard procedure for health surveillance. It emphasizes the need for tests that scrutinize the effects of hazardous substances and monitor the health of employees. Therefore, option C is incorrect. In summary, option B is correct because it aligns with the paragraph's statement about the standard procedure for health surveillance, which involves the formulation of tests for close scrutiny. Options A and C are incorrect because they do not accurately reflect the focus of the paragraph and the purpose of health surveillance.
Let's look at the next question.
According to the paragraph, needle stick injuries must be handled by following the laid out steps for complete care. Here's the explanation in simple English. The paragraph provides guidelines for healthcare workers on how to address needle stick injuries. It states that when a needle stick injury occurs, the injured healthcare worker should prioritize their safety and the safety of the client. The guidelines recommend that the healthcare worker immediately stop what they are doing, if it is safe to do so, remove gloves, and wash both hands and the area of the injury with soap and water. They should not use antiseptics or scrubbing brushes. If the healthcare worker is in the middle of a procedure, another qualified provider should take over and complete it. If no other qualified provider is available, the injured provider should ensure that any critical step is completed, wash their hands and the area of the injury, change gloves, and then complete the procedure. Additionally, the injured provider should inform senior staff or managers at the clinic and follow clinic protocols for managing the injury. Now let's analyze the other options and explain why they are incorrect. B. Primarily completing any critical procedures. While the paragraph mentions the importance of completing critical steps if the provider is in the middle of a procedure, it does not state that this is the primary way to handle needle stick injuries. The paragraph emphasizes following the laid out steps for complete care, which includes washing hands, cleaning the area of the injury, and following clinic protocols. Therefore, option B is incorrect. C. Exercising caution and refraining from routine. The paragraph does not mention exercising caution and refraining from routine as the primary way to handle needle stick injuries. It focuses on specific steps for complete care and following clinic protocols. Therefore, option C is incorrect. In summary, option A is correct because it aligns with the paragraph's statement about handling needle stick injuries by following the laid out steps for complete care. Options B and C are incorrect because they are not explicitly mentioned in the paragraph and do not accurately reflect the recommended actions for addressing needle stick injuries.
Let's look at the next question.
According to the paragraph, the circular conveys information on managing bloodborne pathogens. Here's the explanation in simple English. The paragraph discusses the increased risk of accidental exposure to bloodborne pathogens, such as hepatitis B, hepatitis C, and HIV, among healthcare workers. It provides a minimum approach to health and safety practices for healthcare providers and waste workers. These practices include implementing standardized management approaches, ensuring compulsory vaccination for hepatitis B, providing sharps disposal boxes, complying with hand hygiene standards, and making appropriate personal protective equipment available. The paragraph also mentions that in the event of a needle stick injury, the injured person should hand over their duties to another provider, wash the area with soap and water, and report the injury to the nearest health facility that provides post-exposure prophylaxis services. Based on this information, the circular conveys information about managing bloodborne pathogens, including practices to prevent exposure and guidelines for handling injuries. Now let's analyze the other options and explain why they are incorrect. B. The policy implementation required for personnel. The paragraph does mention the implementation of standardized management approaches and the appointment of staff members for infection control responsibilities. However, these are part of the health and safety practices mentioned, rather than the main focus of the circular. Therefore, option B is incorrect. C. Preventative measures to reduce pathogenic risk. While the paragraph does mention measures such as vaccination, disposal boxes, hand hygiene, and personal protective equipment, it primarily focuses on managing bloodborne pathogens and handling needle stick injuries. It provides information on what to do after an exposure has occurred rather than solely focusing on preventative measures. Therefore, option C is incorrect. In summary, option A is correct because it aligns with the paragraph's statement about the circular conveying information on managing bloodborne pathogens. Options B and C are incorrect because they do not fully capture the main focus and content of the paragraph, which centers around managing bloodborne pathogens and providing guidelines for handling needle stick injuries.